Good morning, everyone. As you all know, our topic today is suicide. And the reason why we have chosen this particular topic is because suicide and suicidal behaviors are a major health issue in New Zealand at the moment. Each year, approximately 500 people take their own lives. Looking at the Stats New Zealand data, I'm sure all of you have seen that. In 2011, the total Maori suicide rate was 16.8 per thousand Maori population. This is 1.8 times higher than the non-Maori rate. Between 1996 and 2011, the non-Maori male suicide rate trended downwards, while the trend for Maori male suicide rate was less pronounced. Moving further, in 2011, the Maori youth suicide rate was 36.4, and I think you will agree that's quite a lot.
Yeah.
This was 2.4 times higher than the equivalent rate for non-Maori. The youth rates for non-Maori are trending downwards over time, but the Maori rates show no such trend. And overall, the suicide rate between 1996 and 2011 declined among non-Maori males by 35%, quite big, whereas the rate for Maori males was highly variable over the whole period. There was no obvious trends in evidence for either Maori or non-Maori. Let's move further and talk to Steve. Let's see what he has to say about the initiatives out there for suicide.
Yes, I'm going to tell about the initiatives. There is a broad range of suicide prevention initiatives underway for Maori across the country. All policies and programs for Maori aim to reduce risk and increase resilience for them, as well as promote the well-being of Maori society. In 1998, New Zealand Youth Suicide Prevention Strategy was a framework for youth suicide prevention, including Maori youth. In 2006, all-age New Zealand Suicide Prevention Strategy year 2002 to 2016 provided for a framework for achieving whanaora, that is Maori family health and well-being. In 2008, New Zealand Suicide Prevention Action Plan 2008 and 2012 launched. The action plan indicates how each action should be implemented following the whanaora pathway. I will introduce some initiatives targeting mainly at Maori suicide prevention as well as general suicide prevention initiatives that are also responsive to Maori. First, Kia Pikite Ora National Maori Suicide Prevention Program aims to improve the coordination of existing services, identify areas where additional service development is needed, and facilitate local action to address these issues. Second, Te Rao Matatini support Maori workforce development to enhance whanaora, mental health and well-being. Third, the District Health Board Suicide Prevention Coordinator pilot involves establishing suicide prevention coordinators in 5 DHBs to work with local agencies. Finally, Child, Youth and Family Suicide Prevention Program aims to support young people who are in care or sick. Ada will discuss about nursing nurse.
Thank you, Mr. Ho. And based on Mr. Ho's introduced the initiative, we will talk about nursing roles. The promotion nursing mental health and well-being is the best way to prevent Maori suicide. Health promotion is a process of enhance the capacity of people and their communities to take control of their lives and improve their mental health, so that improve their well-being. It consists not only people who experience mental illness, but also the mental health needs of Maori population as a whole society to address the underlying determinants of mental well-being. As nurses, we play a critical role during this process.
Yeah, that's right.
The first action should focus on Maori society to meet their mental health needs. Nurses should dedicate to eliminate the inequality in accessing to health services. For example, the process Tirana or Rankawa follow all the program. It provides community health services based on the 20 MRIs in the Manila region. The services provide health promotion. It picks up many people who haven't been to GP for years by taking our services to Murai, called Hanga Ona, and into people's homes. And this program have been able to reach people who have been sleeping through the health net. The second is build up the partner relationship with the Maori community to provide mental health promotion to enhance the capacity of Maori people and their community to take control their lives. For example, the program, the Maori Hona program, it provides Maori health care within the Franklin district. The nurses collaborate with the local Morais to provide health lifestyle education through organized activities such as nutrition guidelines, mobilization, etc. The second action should focus on Maori individuals. The nurses collaborate with Maori community to screen the people who are at high risk of suicide. The second is work with other services such as WANS, social workers to support the people who with some mental health issues or disabilities in employment. Then they can minimize the impact of disability or illness on their socio-economical position so that improve their life quality and well-being. The third one is reduce the impact of event on the suicide survivors. Now, Hans is going to introduce the Maori health providers.
Okay, thank you, Aida. And the Maori health provider chosen for this topic is Raukura Haurora Otainui Kitamaki. And this service, they introduced the Kia Piki to Otara, Tiora, which deals about preventing suicide. And this service is based in South Auckland. It focuses on promoting Maori people's health and well-being, and as well as helping to reduce the number of suicide and suicidal behavior amongst Maori people. And the service focuses on 4 objects, which are promoting mental health, mental health and well-being for Maori, contribute to improve mental health services for Maori, reduce the access to means, increase self-reporting of suicide by media. And Raukura Aurora Otainui Kitamaki, the staff are available to help and support the community, and the staff advocates to individuals and their fund over seeking help or who are at risk of self-harm. Their aim is to achieve maximum health and well-being to enjoy a better quality of life. And the service is free and may be accessed by contacting the Tamaki Regional Office. The referral can be done by any member of the public. It could be like GP referrals, self-referrals, other professionals, or final referrals. And the nurses outside the service, the ones especially who work in the community, they have to make sure that they establish therapeutic relationship with the patients and be direct if they have got any concerns about any changes, like I'm talking about their behavior. And nurses should know all their patients are linked to the trust and be alerted to any challenges. And they should also be aware of the ends and objectives of the trust, and they have to have regular interactions and meetings with service of the staff, and also have to work along with the patients to help them to identify their technical support, coping techniques. And also, like, you might find the ones who don't have families, so we have to talk to the family to seek family support so that they can work with them through their recovery. And Desmond is going to discuss more about the recommendations.
Cool. Yeah, so we came up with some recommendations, and first of all, most people are not comfortable enough to tell a stranger that they're having suicidal thoughts. And as nurses, if you know someone who is very distressed or maybe suicidal, the first thing that you have to know is that you have to take their feelings and thoughts very seriously, especially if you've noticed signs and symptoms of depression. One recommendation, the first recommendation that I would make is just having an autonomous suicide prevention healthcare provider for Maori, whose sole purpose is to help young people to overcome certain issues that predispose them to suicidal ideations, and also just have more one-to-one time with the client and the client's spinal, as this promotes a healthy environment where the client can be able to voice out their concerns. And also it is within the safe structure of a final meeting with proper rituals of opening and closure that most Maori people feel comfortable enough to express their concerns. And as nurses, I think we need to put more effort on building therapeutic relationships with Maori clients. If only nurses would put more effort in trying to understand the tangata whenua, the way of life, a higher number of Maori people facing challenging issues would be more open to talk about their issues. And also, all Maori nurses need to be encouraged to take part in professional development programs, such as the Huarahi Whakatu, which is a nursing council accredited professional development and recognition program, specifically tailored by and for Maori registered nurses. This program is coordinated by a Maori registered nurse, guided by a cultural and clinical governance board with access to mentors and Maori assessors. And then for us as nurses, I think we need to be culturally competent for better health outcomes. There's a program called Maori Ora, which needs to be compulsory for all nurses in New Zealand. It is a current program that was developed specifically for the registered New Zealand health workforce, and provides a basic understanding of cultural competency and health literacy in the New Zealand health context. And because Maori health is highlighted throughout the course due to the significant health disparities that exist in Maori communities, and they offer free online courses for Maori cultural competency, which I think is pretty awesome. And this one thing, I'll finish with this one thing. I think as nurses, you should follow your first instinct, and ask direct questions. For example, are you thinking of committing suicide, and do you have a plan? I think we just need to be more direct, and that's the last recommendation that I'll make.
Thank you everyone for the
Thank you.
discussion today.